beef processing plant. And that'll be it for today. And then tomorrow we'll have Mayor McComb and Nueces County Judge Barbara Canales will be here to provide additional information on this situation. Okay, so we're going to begin with the cases. So every day at 4 o'clock, we look back at the past 24 hours to see what type of new cases we may have received in terms of COVID-19, as well as transition from persons that may have been in the hospital or are entering into the hospital. And so this information is updated since yesterday at 4 o'clock. Today is a big number. We should see it up on the screen here any minute. We have a total of 15 new cases. This would be the most significant one-day total since we've been tracking this. The prior number had been 9. That was many weeks ago. So in total, with the 15 from today, we have a total of 147 cases in Nueces County. And I'll explain, I guess I can explain now. So the 15 additional cases, the majority of those 13 have come from one location. It's a transitional housing facility in the near downtown area, and it's called Dismas Charities is the operator. It's a transitional housing where persons are living there for a point in time, and then they eventually get permanent housing. And at any one point, there could be up to 30 persons living there, but as of today, the only persons living there are the 13 that have the coronavirus, and they're quarantined or isolated in that facility as part of the 14-day recovery program. And so they're quarantined there. There's no other persons that are there living there at this time. The other persons that had lived there have been moved out to other facilities that are run by Dismas or related entities that they have a relationship with. And then the other two for the city are just general persons in the community. So a total of 147 today. I'm going to show you some graphs in a little bit that'll kind of help put some of our tracking in perspective. Our cases are going up in part because of some large numbers like today's. Annette's going to talk to us and give us an update on the STX beef processing plant. We've, through the state's help, through the National Guard, have tested many, if not just about all the employees there, and they have up to 800 employees, so we may see some big numbers coming out of that as well, and we'll share that with you when the test analysis is conducted or completed, which will be along this week. Okay, so reporting number of deaths in Nueces County, it's still a total of 3. That number has not changed since last week. Today's caseload of 15 new cases were predominantly male. There were 14 out of the 15, 1 female, so that begins to change what was a pretty even split. There's 56% male that have had COVID-19 and 44% female. And then about across the board, pretty much on the age group, we're tracking the ages of persons that have had COVID-19 over 9 different age categories ranging from 0 to 90 years plus. And the number of cases adds 2 in just about every bracket except for the 70 plus and the 0 to 19, 2 or 3 have been added. So it's pretty evenly distributed across the age groups now. Our number of tests completed in the area, whether we're analyzing tests or the National Guard is conducting testing, as we know they've been doing at STX, beef processing. And then the hospitals and clinics submitting lab tests to be performed. In Nueces County, we had 378 tests performed today. So that brings our total to 4,754 tests to date since we've been tracking. So I'm going to show you that chart in a little bit, but you can see not only a case is going up, but testing is going up as well, and our 7-day average is up. But one word of caution is that even when testing was going up a couple of weeks ago, the number of cases were going down. So just because testing's going up doesn't mean that's why we have more cases. And as they told us Friday, our team from Texas A&M Corpus Christi, that's not the only contributing factor. It's just more spread in the community in some of these big facilities like STX, and then this transitional housing situation as well. Okay, before we look at those graphs, or I guess here's one here, our pie chart or our donut chart. So the number that have been in the hospital since we've been tracking this is 35. That went up from 2 since last week. Numbers in the hospital, there's still 7 in the hospital. We had 2 released, but 2 new persons were admitted. So 7 currently in the hospital recovering with COVID-19. 4 of those are in intensive care. And so the other 3 are in general care recovering. Our recovered rate is still 78 persons, but because we have more cases now, the percentage is a little bit lower than what it was Friday. So 54% have recovered. You can see right here. That's slice, and then 66 are still active. So we still do have a majority recovered though, but a little bit more since last week in terms of the active. And then all of those 15 new cases for today were from the city of Corpus Christi. So that brings our total to 129. And of the remaining difference between the 147 is 2 are from Robstown, 7 from Port Aransas, 7 from rural Nueces County, 1 from Agua Dulce, and then 1 from Bishop. And that's a distribution of where the folks are. So on this graph here, we wanted to point out, we showed you this last week as well, but you can see this week, that far bar over here. That's today's number of tests, and you can see the red or the orangish line continues to go up. That 7-day average continues to go up. We have over 200 is today's 7-day average. So if you look back at a 7 days in a point in time, that shows you our 7-day average testing. And today it's at 200. So that's good news that the amount of tests are going up. Now I do want to show you this next graph that we put together for today. This shows the number of confirmed cases, and it's an average 7-day rolling number. So it's not a point in time, but it looks at any one of these points is an average of a 7-day block of time. And you can see on 4/24 down here, our number of cases dropped significantly, right? You may recall we were talking about the average number of, or the running average was 0.5. So there was less than a case per day for a 7-day average. With today's numbers, and even before today's numbers, you can see that trend began to change. We were up to 2, 3. Today we're up to 5. There's 5 over here, and here's today. So today our trend is actually higher than it's ever been, which over here would be the highest point. So today we're trending on average, when you look at a 7-day average, 5 cases a day. And that's the highest point. And we were making pretty good progress down here, where we had not even 1 case on average a day. And just to repeat it again, if you look at those 2 points in time, we're going to look at this low point here, and then we're going to go back 1 graph and look at that orange line that shows number of tests. If they can go back 1. There we go. So right around the same time when we had that 0 or 0.5, our number of tests were going up. So on average back then we were doing about 100 tests a day. Today on average we're up to 200. So the point is our testing was going up, but the transmission and the spread was going down at the same time. Admittedly, the tests obviously are much higher today, but the fact that we're at, on the next slide, a running 7-day average of the highest point to date is not just attributed to more testing, but it's attributed to spread and also to some of these large facilities that we're testing at today. Okay, so that's a summary of the statistics. Today has that additional 15 cases, and we just want to be prepared that this week we'll probably see some other significant numbers as we get the results back from our beef processing plant testing operation that took place over the weekend. Okay, so that concludes my portion of the presentation. Gabby's going to translate this into Spanish, and then we'll have Annette Rodriguez talk to us about tomorrow's drive-through testing and give more information on the STX, 'T, X and this transitional house situation as well.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 15 casos confirmados por el coronavirus, haciendo un total de 147 casos en el condado. 83 son hombres y 64 son mujeres. La mayoría se encuentran en el rango de edades entre 30 y 39 años. A la fecha se han llevado a cabo 4.754 pruebas por el virus entre el Distrito de Salud Pública y laboratorios privados. De los 147 casos, 129 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas, 7 son residentes de áreas rurales. 78 de los 147 casos se han recuperado por completo. 35 han sido hospitalizados, 7 continúan en el hospital y 4 están en condición crítica en la unidad de cuidados intensivos. 66 casos aún continúan activos y se reporta a la fecha 3 fallecimientos.
Thank you. Annette Rodriguez, Health Director. So the next drive-through will be tomorrow at Bishop, Texas, and it will start sharply at 8 in the morning. Then on Thursday, May the 14th, we will be back at the Old Memorial Hospital to continue testing. Anyone with COVID-19 symptoms should be calling the 826-7200 to get screened so that we can pre-register you to go through the drive-through. To give the community an update on our halfway house situation, this weekend, all residents and employees from the halfway house that we reported with positive cases were tested. The test results came back today, and 14 additional people in the home tested positive. 13 of them were residents, and 1 was an employee. That brings the total number to 19 positive cases in the halfway home. We are being told by the facility that some of these individuals that tested positive were employed at the STX meat plant. As we learn more about this novel virus, these cases confirm that we need to be extremely attentive to congregate settings where people are in close quarters, sharing meals, sleeping quarters, and sharing other common areas. I will also give an update on the STX meat processing plant. This past Saturday, the National Guard began collecting samples from all employees. 340 samples were collected on Saturday, and they're planning to collect at least 200 samples today. Test results should be back by the end of this week. In the meantime, the Health District will continue to work with the STX corporate office to institute good infection control practices. From what we are continuing to learn from these cases, the community should be extremely vigilant with instituting good public health mitigation techniques and prevention protocols. That includes, and we have repeated these several times, good hand washing, at least 20 seconds, instituting good disinfecting and sanitizing processes, social distancing, and screening for symptomatic individuals as the virus spreads very quickly from person to person. These methods or practices, if instituted properly, should help mitigate the transmission of COVID-19. Again, as I mentioned last week, if you have been diagnosed with COVID-19, you are not allowed to go to work, and you should isolate from the rest of the healthy population. I think the mayor says it very well. So sick people stay away from healthy people, and healthy people stay away from those that are sick. No one should be at work that's sick, especially with a very contagious virus such as the COVID-19. The only way you can go back to work is when you are fully recovered and have met the CDC guidelines. I know it has been tough, but the more we work together as a community, the more we can protect our at-risk population and prevent further spread of COVID-19. Stay home, stay safe, and stay informed. This continues to be a dynamic situation, and it is imperative that we all stay informed. Thank you.
En resumen, la próxima toma de especímenes va a ser mañana en el poblado de Bishop, posteriormente el jueves 14 de mayo en el Hospital Memorial. Cualquier persona con síntomas del COVID-19 debe llamar al 361-826-7200 para hacer cita y le tomen una prueba. Este fin de semana todos los residentes y empleados del centro de rehabilitación fueron evaluados. Los resultados de las pruebas se recibieron hoy. 14 personas adicionales resultaron positivas a la presencia del virus, haciendo un gran total de 19 positivos. Este es un ejemplo para mantener la distancia y evitar congregación de gente, especialmente al compartir áreas comunes. En cuanto a la planta procesadora de carne, South Texas Beef, la Guardia Nacional comenzó a recolectar muestras de todos los empleados. Ya se han recolectado 340 muestras y se planea recolectar otras 200. Se espera que los resultados estén disponibles este fin de semana. El Distrito de Salud continuará dando asesoría a la planta para controlar infecciones. Con estos nuevos resultados, se le pide a la comunidad no bajar la guardia y continuar practicando todas las medidas sanitarias y medidas de prevención. Si usted ha sido diagnosticado con COVID-19, no se le permite ir a trabajar y debe aislarse del resto de la población sana. A nadie se le debe permitir ir a trabajar enfermo, especialmente con un virus contagioso como el COVID-19. La única forma en que puede volver a trabajar es cuando esté completamente recuperado y cumple con las pautas de los Centros de Control de Enfermedades o CDC.
Okay, that concludes our prepared remarks for today's press briefing, and Annette and I are here to answer any questions that you might have.
Okay. It's going to be for.
We'll let Courtney go first.
They're going
Okay,
to
sure,
for
yeah.
Annette. Okay. Do we know how many people from the halfway house who have tested positive work at STX Beef?
Yes, we have 3.
3 people. Sorry. Are any of the people at the halfway house recently released from jail?
The way I understand it is all of those that are residents have come from a federal prison to this location. So,
And so that it's from a federal prison outside of our area, so, correct.
Federal or state?
I'm just curious if we are testing in any jails that these people may have come from, or if they're coming from outside of.
well, they probably would be, if there was people with COVID-19 in those locations, but that wouldn't be us doing that.
How concerned is the city looking into the matter? Are you guys looking at this a lot more closely with, what's
Well,
going on?
Definitely, yes. We're looking at it very closely because that's it's a small facility, fairly small, between 30 and 35 individuals at one time, including workers and residents. And so when you have that many people that are positive for COVID-19, there is definitely something that's, not going the way we would like for it to go. I think some of the concerns that we had were the sleeping quarters. They sleep very closely together. There isn't separate sleeping quarters, the male, the females. So that's one of them. Also, they eat together, everything they do together. They share one restroom for males, one restroom for females. All of those things are very concerning. So you really have to have really good sanitizing, disinfecting processes to be able to keep the spread at a minimum for these types of congregate facilities.
We know that the plant is an essential plant and it has to stay open through all this. At some point, when does the state or local officials step in and say, hey, the numbers are too high?
Well, and that's a great question. So we've been talking about that because as you test, the whole population, you're going to get probably some more positives. And so we've been looking at that. What we're looking at right now is whatever number we get after all of them have been tested, that's going to be what we consider like our baseline number, kind of that's where we're starting. And so what you look at is as the days pass, are the numbers continuing to increase? Are they staying steady? Are they actually declining? Because if they're declining, that'd be a good sign that all of the practices that were put in place are actually working. If they're increasing, it either means that the practices aren't being practiced or that there's something else that is being missed. And so a lot of things have been looked at the STX with the corporate's help, because we don't go in there. That's the other thing. With this new COVID-19, you're not allowed to actually go into the facilities because you don't want to put yourself at risk either. So we have to FaceTime or look at them through pictures. So some of the things that they've instituted have been like plexiglass, like in their cafeteria between people, because when you eat, you have to take off your mask. But there's still a lot of people eating at the same time. So we've looked at like where do they smoke, how do they clock in, how do they clock out, all of these things, how are they cleaning? They have a third party, I think, that comes comes in and cleans in the evening. How are they cleaning? What are they using to clean? You know, how thorough is the cleaning? Some of the bigger concerns are like social distancing. And some of these plants, it's very hard to do the job that you need to do and social distance at the same time. So we're looking at that. So if you go back to the numbers as the baseline, we're going to look to see if there's increases, especially if there's exponential increases. Something's not going right, and we actually need to think about it, doing it differently, or maybe even at some point think about actually closing the plant.
You said about, on May 6th, that the South Texas employees, they were able to work if they were asymptomatic. Is that still the case?
Absolutely, yes. So that's supposed to actually help offset some of this. So what happens is, as you have people that are sick with COVID-19, they have to be taken out of that population, so they cannot work at the STX meat plant. But if you have contacts, so they're with 7 people around them, but those people are asymptomatic, they have no symptoms, they can actually work, but they still have to wear their mask and their personal protective gear, and they can actually still work. Once they become symptomatic, if they do, they have to be taken out of the population as well.
Do we have a total number for how many people have tested positive at XTX beef?
What I have on my record is 10, so, but with these additional ones, it's probably going to be, you know, maybe 15 to 20 more. So until we actually start contact tracing, I need to know exactly how many people from the halfway house actually do work at the meat plant. Thank you.
Annette, some of the questions on Facebook, so the 13 persons at the transitional house, they are quarantined at the house, and they're not going to the grocery store, they're not going to the convenience store, they're not going to Walmart, right? They are stuck at the house for 14 days. At least. So the community, some of the comments I was watching on Facebook, they at this point are quarantined at that facility. That's correct. And so that's good news for the persons that may be worried. But if people are worried about getting the virus, they should wear face masks, right? They should maybe not go out themselves. They can get groceries delivered. They can practice social distancing. They can keep their hands clean. Don't touch their face with dirty hands, right? That's the best way. Some of the comments included, we need to trace every step these persons took and report that out, but that's almost an unaccomplishable feat, right?
Well, we're going to try.
They're going to try. We're going to try, but we won't be reporting exactly where they went to the community, right?
Right, so
Yeah.
we look at 2 days before they became symptomatic, and we try to trace where they went.
Yeah, we'll try, but short of that, some of those techniques that we've been talking about for over 2 months now are the best ones to use. Social distancing, stay at home if you don't have to go out, wear a mask, keep your hands clean, don't touch your face. Okay, good. Well, we appreciate the community watching. This is important for your information and safety, and we appreciate you communicating with your friends, families, neighbors, and so on, the news that we report out each day here to you. We'll be back tomorrow at 5 o'clock, myself and Annette, and then we'll also have County Judge Barbara Canales and Mayor Joe McComb. Have a good night. Thank you.